Hey, Kate.
Hey, Eric.
I'm very excited for today's guest. Today we have Susan Kelly Westman on our podcast. Susan is a social worker for the York Hospital Oncology program, acting as a sounding board and resource for patients and families at 3 locations, York, Kittery, and Wells. I'm looking forward to our conversation with Susan about the programming, community fundraising, and so much more.
Hi, I'm Kate Ford.
And I'm Eric Fogg.
Welcome to Seatown. In each episode, we will discuss all things York Hospital, past, present, and future, as well as current medical topics to help us navigate that sometimes confusing world of healthcare.
But before we get to that great conversation, let's do some hospital updates.
That sounds good. Do you know that March is Colon Cancer Awareness Month?
I do. We talked about this briefly, but let's go over it again. As Colon Cancer Awareness Month, we're asking all of our listeners and folks to reach out and contact their primary care provider about appropriate screening and whether or not it's time for your colonoscopy. So go ahead and give your primary care provider a call about that. Some other hospital announcements. I think it's appropriate every so often to remind folks about the York Hospital Fun Run for Everyone. It's our annual 5K run walk. It's taking place here at York Hospital on June the 6th. It's one of our biggest fundraising events. We typically get well over 400, if not 500 runners every year, which actually speaks a lot for the program because there's so many 5Ks nowadays that they're competitive and everyone can't run in every one. But the fact that York Hospital gets huge numbers every year speaks to the history of that program.
Well, I like the change in name too, because it really is for everybody.
Yeah.
Walkers and runners
and it's a fun run, particularly when you're running over the Wiggly Bridge, right?
Which can be a little challenging.
It is. It checks your balance, right, and equilibrium, that sort of thing. And it's, it starts at the hospital and finishes at the hospital. And if you're anyone who does walk runs, the hill to finish coming up into the parking lot is quite that challenge. It's a good, strong way to finish the race. So check that out and sign up for that if you haven't already. It's a great event and raises some good money for York Hospital. Also, the Hancock Classic, which takes place on August 6th at the Viewpoint Hotel here in York. It overviews the Nubble. Beautiful location. It's a great program here at York Hospital, so check that event out.
Have you been yet?
I went last year to the Cliff House, and
I went the year before.
It was beautiful. It was outstanding. I got outbid on something I really, really wanted at the auction. It didn't work out in my favor, but I tried really hard. But maybe this year we'll get something good.
Good luck.
Thank you. So without further ado, let's get to today's guest.
Well, Eric, we have Susan Kelly Westman here from the Oncology, York Hospital Oncology. So Susan received her master's in social work from UNH, right around the corner. She's worked at York Hospital since 2005 as an outpatient social worker. She started in the cardiac rehab program, which was back then called Heart Health Institute, now called the Living Well Center. And she started in 2009 in oncology as the social worker. So I thought we could get started with how she was thrown into cancer. Sorry to start on a sad note, but it really does. I think it will explain why you're so passionate about this topic, but why she was thrown into the cancer world at age 30.
So when I was 6 months pregnant, my husband was diagnosed with a brain tumor, a very grade 4 glioblastoma, which is a very aggressive type of brain cancer. So when he was diagnosed, we were basically told he had about 6 weeks to live. Tumor was inoperable. I was 5 months pregnant at the time. We had a lot going on. We couldn't take that for an answer, so we sought out a lot of different medical opinions. We were living in California at the time and sought out some great opinions at UCLA Medical Center and USC. We found a surgeon up in Santa Barbara at a small hospital, Cottage Hospital, who was willing to try surgery to get out the bulk of the tumor, which was successful. Went through 6 weeks of radiation at UCLA. In that time, the tumor actually grew back, and we decided it was time to move back east to be with my family because I would need that extra support. So we moved back here to York, and we started getting treated down in Boston at Brigham and Women's. And he actually lived for 17 months from date of diagnosis, which is, to us, it was a great success. He got to see his daughter be born, got to spend a year of his life with her. And from there, it was after going through all of that, I decided to go back to school for my master's in social work, because along that journey, there wasn't a lot of questioning how we were doing as a family unit. It was very medically based on the patient.
And you bring that to the
I try.
table. Yes,
Yeah.
you do, for sure.
Yeah.
What a powerful story.
I know.
it's,
I'm sorry to start off like
Yeah,
that, but I
but-
think it does explain a lot. And to not bring that up, I think, would be.
Yeah, thank you for sharing that. Wow. We had this happen with Linda Westinghouse
Yes,
when we
we
talked
did.
about what got her into this, and she shared a story about her daughter's cystic fibrosis diagnosis at the age of 2 that changed her trajectory and path. So,
I think a lot of us, our personal experiences bring us to what we do.
right.
And hopefully most of us have satisfaction in our jobs.
Yeah.
And so we choose careers that give us that satisfaction.
To that. Yeah.
Wow. Great.
Well, let's start by talking about where people can find you. I know that you're in 3 different locations now, and maybe even just touching on the staff that you have.
Sure. So we have 3 locations. We have a location in Kittery. It's at the bypass. We have one on Long Sands Road in York, and a site also up in Wells at the urgent care place. So we're in all 3 sites. I have an office in the York office, and then I travel to other sites depending where patients are and what their needs are. Our staff, we have 2 doctors, Dr. Peter Georges and Dr. Marilyn McLaughlin that I work with, and as well as a nurse practitioner, Eleanor Kurtz. We have 8 chemotherapy oncology certified nurses who provide the care for the patients. We have lab techs, we have MA. We have 2 pharmacists who do all the mixing and getting things ready, administrative assistants, and then folks like myself, the social worker. We have a nutritionist, pre-certification specialist for insurance issues and concerns, tumor register, nutritionist, physical therapist, financial navigator, and prescription assistance services. So those are our bulk of our staff. York Hospital Oncology provides medical oncology, hematology, drug treatment, chemotherapy, infusion therapy, lab services, clinical trial management. We have a few clinical trials opened here at York Hospital. And then we refer folks out for our radiation services because it's something we don't have here. So they usually either go to Wentworth Douglas or up to York County Center for Cancer Care.
And if they needed surgery, what happens there?
Most of our patients get surgery right here at York Hospital, depending what type of cancer they have. So different cancers, obviously we don't have brain surgery here, so someone would be referred out. We don't do a lot of surgery, any surgeries on pancreatic patients, so those also would be referred out. So depending what the diagnosis is, depends where the surgery would happen, but oftentimes our patients are treated right here at York for surgery.
And the affiliation with Mass General Hospital is a good one for
It's
that.
a good thing.
Yes, it is.
Yeah, it helps get our patients right down to Boston, get in quickly with some of the best specialists in the world. So, yeah.
So when you were telling your story, I wanted you to talk about your role. You kind of touched on it a little bit more, but was there anything we missed about your role within oncology and how you work with patients and families?
So how I get involved with patients and families, a couple different ways. Doctors can refer patients. The nurses, any of our staff, if they notice someone's struggling with something. We also do something called a NCCN distress screen, which is a self-reported kind of like a little evaluation that the patient completes. So if there's any sort of red flags or things that perhaps they need to talk about or see someone about or be connected to a resource, I will get involved with the patient and kind of help them through whatever they might be going through. We screen for depression, so if we see some of that, I'll get involved with folks. And just kind of the whole cancer journey, wherever a patient is. If they're just diagnosed and scared to death, I can spend a little time talking, letting them know kind of what is going to happen as best as we can tell, what, offer different things that might help along the way. Things like we offer massage, we offer acupuncture. We have a lot of programming.
That was my next question, is talk a little bit about, I didn't realize all the programming options you had for patients.
Right.
Yeah.
When I started 11 years ago, we had absolutely nothing. We didn't even have a support group at that time. So it was really important to me as I took on this role to start creating things that help patients along the way. So one of them was I started a Living Well with Cancer support group, which meets monthly. All of our patients are welcome to attend. And that gives a little bit of that peer support that folks sometimes need as they're going through this. We also have a caregiver support group for the family members. So if they're struggling going through, we also have that group that meets monthly. And then after that, I could talk for a long time about everything, but
On
we
your
have
programming.
a lot of exercise classes. So we have a woman who's a breast cancer survivor, Elisa Frazier, who does 3 different exercise classes for different levels of people. We have yoga classes, we have Nordic walking, Zumba Gold classes for the patient who that physical activity is important and kind of looking for that. We have art therapy classes, things like Zentangle, meditative drawing classes. We do a silk scarf painting workshop.
You ever heard of Zentangle?
Can't say that I have.
Oh, it's an art
Yeah,
therapy.
it's kind of based on the idea of doodling.
Yeah.
So, you take a pen and you're in a lecture and you just start doodling, it's sort of that, but it's much prettier. And it's supposed to be very relaxing because much like meditation, suddenly all your focus is on what you're doing and on that drawing. So everything else kind of clears out and you just focus on something very small. So it's very helpful for a lot of people. We also do a writer's workshop for people who like to write and process things that way. Music therapy. So we bring in a person who's trained in that and does some classes.
I know I have a few volunteers that provide Reiki,
Yep.
and they'll actually do it for families and staff and
Yep.
the whole shebang.
Yeah. So we offer, Reiki, massage, acupuncture. We have force therapy walking that we offer for patients. So that's another one of those sort of meditative things. They've done a lot of studies with being out in nature and how healing that can be and being grounded, touching the ground and those sorts of things. So we have a man who comes in and does a few sessions a year where we go out on walks with our patients, and there's a little meditative quality. We do a lot of reflecting and observing with all your senses, the sight and smell and touch, and another way to help manage some of the stress related with a cancer diagnosis.
So I'm really taken back by how robust this program is, from all of those offerings to just the delivery of medications and everything. I've been in medicine for 20 plus years. Oncology is not my lane per se, but my understanding is that 10 years ago at a community hospital, if a patient, or 15 years ago, if a patient had a cancer diagnosis, they often went to the academic centers, and that's where the best of the best were and that sort of thing. My understanding of cancer care and cancer therapy is they're all protocols. They're all protocols now, and those protocols are prescriptive depending on the type of cancer and that sort of thing. And the value now of a small community hospital like York Hospital is you could have a cancer diagnosis, you could go to Boston and get that protocol assigned, so to speak, but have that care delivered here at York Hospital. Is that?
That is correct.
Yeah.
We always say that the drug in the bag that gets infused is the exact same drug in Boston as it is in York, Maine.
Right.
So it's kind of a matter of convenience. In a lot of
You're
way.
being close to home and your loved ones and the support, that's a huge step in cancer care that's probably evolved over the last 10 or 15 years.
Yeah.
So a little small community hospital like York Hospital, you can get that same drug in the bag, so to speak.
Yep.
In addition to that, everything we've spent the last 5 or 10 minutes talking about, that will enhance, right, your care and hopefully improve your outcome and provide an environment where healing can take place. That's pretty remarkable. Kudos to you and your team for putting that all together. I mean, you mentioned 11 years ago, there's nothing to all of this. That's outstanding.
Yeah, we've done a lot of work along the way and tried to figure out, we've tested out a lot of different things, what programs work, what don't work, what people are interested in. We also do a lunch and learn series, so we do that about 8 times a year, bring in a speaker, provide lunch. The patients really enjoy that. We do also a cooking demonstration at Stonewall Kitchen once a year, which our patients, I think that's a favorite for everyone.
Well, I was going to say, what is the most popular offering that you? What's the big ticket
Put me
item?
on the spot. People do love Stonewall Kitchen
Yeah.
a lot. The other thing we do is we provide free wigs and hats for our patients who are losing their hair. So that is one of those things that a lot of women are very appreciative, because it happens usually about 3 weeks after they get their first treatment. And so we go in kind of ahead of that, prepare them, and try to get them linked up with whatever they think they're going to want in that respect. Massage and acupuncture are hugely popular. And we offer 6 free massage treatments, 6 free acupuncture treatments. Everything we offer is free to the patient. So we do a lot of fundraising. We have the Breast Cancer Living Well Fund, and we have the Living Well with Cancer Fund that is able to provide everything for the patients.
In our last podcast, we talked about the girls' basketball program at Wells High School and that fundraiser, and we spent a little time talking about the history of that and how much money that's brought in. But we do other fundraising initiatives here at York Hospital that go to support those programs.
Yeah, it's amazing. We just accepted a check last week from the York Boys High School hockey team for $800, and I want to say $10.
Well, they've been doing it, but
Pink in the
pink
rink.
in the rink. That was,
Yeah, so there's a lot of, we have a big Andrew surf competition and car show in the summer, and year after year they've donated to our Living Well with Cancer Fund.
How much is that? That's quite a bit, right?
That's well over, I think, 100,000 at this point. Wow. Yeah, so we have these people who are somehow linked to cancer. It's had an impact on their life, and they want to do something, and they want to turn around and give back and provide some of the basic needs. A lot of people, if they're alone, it's very hard if they can't work full time. Mm-hmm. They have to take time off. They still have a mortgage. They have groceries. They have things like that. They need to get food on the table. So all these grants and programs allow us to offer some of that, which is another thing we do. We can help put fuel in the tank or groceries on the table. Yep. Gas cards. We figured back and forth to Wentworth Douglas for radiation is roughly $300 if you go for a 6-week course. Yep. Yep. And so we're able to give gas cards for those people who just can't afford, cancer care is expensive. So we're able to do a lot that way as well. So we're very...
I know when I was working at the York Community Service Association, because I'm a social worker too, we worked really closely together with providing support to clients that I was working with who had, one particular family is sticking out to me that she had breast cancer and it was stage 4 when it was identified, and the gas cards and food and that you were able to provide to that family was really helpful.
Yeah.
Susan, what's the most rewarding part of your job?
When people come in and they've had a nice clean scan, they're cancer free. Yeah. I really enjoy every part of my job. No 2 days are ever the same. Mm-hmm. And I think that's true of most people in healthcare. You don't know what's going to happen on that day. So I really, I just like being there, helping, pointing people in the right direction, trying to help get them through.
Do you have pet therapy come through at all? Pet therapy?
Funny you should ask. We don't officially have any pet therapy. Okay. It's something we've talked about, and eventually down the line we might do something along those lines. But
we might need to talk. We have some great pet therapy teams.
Yep.
So I was thinking of that because I don't remember seeing that.
Yeah.
Any new additions or expansions to the oncology program coming down that you see in the next year or two?
I know we are expanding actually our site up in Wells.
Yep.
So we're adding some extra treatment rooms, exam rooms. Mm-hmm. So that will be great to see more people. So we're kind of very in the planning phases. I just saw some initial plans, but we will have that coming forward. Let's see what else. We always look at programming. We actually just got in touch with a woman in Wells who does massage, so our Wells patients will stay up in that area when they want massage instead of having to, they used to come to the hospital to see our wellness services here. So this is kind of just easier for them to not have to do extra traveling. So we're always looking at programming and different things to do. I think cancer medicine, which I know you're going to have our colleagues on
Yeah.
to talk
Yes.
about that, but it's amazing what they do nowadays with genetic testing.
Right.
And they can predetermine what chemotherapies will work
Right.
best with what cancer.
Amazing.
So medicine, it's just changing so quickly. So we have great doctors who are all on board with that.
Yeah.
So you have 2 oncologists right now?
We do.
Okay.
Yep.
And we'll have them on, Dr. Georges and Dr. McLaughlin. We'll have a podcast with
An
them. down the road.
upcoming podcast kind of earmarked with those. And then you added the nurse practitioner role to that group here to give some continuity, I think, to that practice.
And it's really great because the nurse practitioners can they work closely with the doctors
Yeah.
and really make it a little more seamless
Yes.
for our patients. And they're sometimes easier to get a hold of if a patient has a quick question about a medication or something like that. So it's a nice.
Eleanor's great. We worked together at Goodall in the emergency room years ago, and when she came back to York, we reconnected a little bit. So I'm glad that it's a perfect position for her. Her temperament, her personality, her style. I'm a big fan of hers.
Yeah, we're very, very lucky that she's part of our team now. We
she's great.
really enjoy it. So, and we still are looking for another oncologist and or another nurse practitioner to join to be fully staffed. So that's
Because you're traveling quite a bit. So is there anything before we sign off that we forgot to mention that you'd like to include?
I just want to stress again how grateful I am for all the fundraising efforts and community efforts and the basketball teams, the hockey teams, the surf competitions. There's a golf tournament that does a memorial golf tournament to us that the people in the community, a lot of memorial donations people make to keep the programming going because there's such value to it for our patients, which is what it's all about. So I'm very grateful. I feel like we have a great community in this area, and I love the fact that it's Wells basketball, York hockey, Kittery basketball, touching
all
our
our
surface areas.
communities, yeah.
It's fantastic. So I'm just very grateful to be part of it.
Well, thank you for all you do for the program and all your team does for our patients. So we greatly appreciate that. You do an excellent job for sure.
Thank you.
Thank you, Susan.
Great.
So what'd you think, Eric? It's a good conversation.
So I probably learned more on this episode and this discussion than any of our previous. It's just I'm certainly aware of our oncology program. I know the physicians. I know kind of what takes place to a certain degree, but the breadth and depth of the offerings at York Hospital, I had no idea. I had no idea. So that was an excellent guest to have on to highlight and showcase that program.
Yeah, we this touched my family most recently, and the care we received was really good. We had Dr. Georges as my dad's oncologist. Unfortunately, my dad did lose his fight, but they were pro treatment. I think the thing that stuck out with me the most is that at 80, so he was diagnosed at 84, they never treated him like an 84-year-old. They always treated him like a healthy adult, which he was.
Sure.
Right up to the end. Yeah. So I think age, when you have a disease like that, needs to be thrown out the door. And because they kept saying that he was healthier than some of the 60-year-olds that were coming through the door.
Sure.
So yeah.
Well, it was a great reminder, too. I think folks still have that notion of you have a cancer diagnosis, you have to go to Boston, or you have to go to Portland, or you have to go to wherever, that a lot of the treatment, evaluation, and care can be delivered right here at York Hospital. And that makes such a difference with the family and the travel. I'm sure it made a difference with your mom and you, and just to be close by and that sort of thing. So great reminder that York Hospital delivers great cancer care right here in York.
That's right, and we'll get into more detail from the oncologist point of view.
Sure.
When we have Dr. McLaughlin and Dr. Georges. So thank you, Eric.
Thank you. So thank you for listening to this episode of Seatown Podcast. Please go to our website or download wherever you get your podcasts, Apple Podcasts or Spotify. And don't forget to check out our new Instagram page at Seatown Podcast. Thanks.
Thank you.
Thank you for listening to this episode of Seatown. We hope you found it of interest and would love to hear from you about topics you'd like to learn more about. Be sure to subscribe wherever you listen to podcasts. You can also find episodes by clicking Seatown button on the homepage of yorkhospital.com. By listening to this podcast, you're agreeing not to use this podcast as medical advice to treat any medical condition in either yourself or others, including but not limited to patients that you are treating. Consult your own provider for any medical issues that you may be having. Seatown is a production of Darcy Creative in collaboration with York Hospital. Copyright 2020.